A presentation of the University of Alabama in Birmingham Dental Television System. Dental Anatomy. Maxillary and Mandibular Third Molars. A telecourse by Dr. Barry Eisenberg, Dr. Wilson Wright, Jr., and Dr. Michael Hughes. Maxillary third molar. General characteristics. The maxillary third molars are the 8th teeth from the midline and are identified according to the universal numbering system as teeth number 1 and number 16. These teeth have a mesial contact with the permanent maxillary second molar, and no distal contact is present. The first evidence of calcification of these teeth is between 7 and 9 years. The enamel layer is completed between the 12th and 16th year, with eruption usually occurring between the 17th and 21st year. Root formation is completed between the 18th and 25th year. The crown of the third molar is generally smaller in all dimensions than the second molar and shows more rounding. The roots are normally shorter than those of the second molar and are often partially or fully fused. The maxillary third molar is the most variable tooth in the upper arch in size, shape, and contours. The crown form. Since the third molar varies so greatly in all aspects, it is difficult to describe a standard, typical third molar. The heart-shaped third molar is the most common form. This is due primarily to the diminished or possibly absent distal lingual cusp, leaving only 3 functional cusps with no distal lingual groove. The groove pattern is variable and often shows many supplemental grooves. Despite the variability in crown form, maxillary third molar specimens are almost always wider buccolingually than mesiodistally. The crown is smaller in all dimensions, especially occlusocervically and mesiodistally. Root form. Similar to the crown, the root form and numbers are extremely variable. The root dimensions are normally the smallest of any maxillary molar. The most common form, usually in conjunction with the heart-shaped crown form, is 3 roots, which may be partially or wholly fused together. Mandibular third molar. General characteristics. The third molars are the 8th teeth from the midline and are identified according to the universal numbering system as teeth number 17 and number 32. The third molar contacts the mandibular second molar mesially, and no distal contact is present. The first evidence of calcification of these teeth is between 8 and 10 years. The enamel layer is completed between the 12th and 16th year, with eruption usually occurring between years 17 and 21. Root formation is completed between the 18th and 25th year. The third molars are often referred to as the wisdom teeth. Crown form. The crown form is so variable that only generalizations about 2 basic types will be made. Type 1. The type 1 crown resembles the permanent second molar. It has 4 cusps and the same general occlusal pattern and contours as the second molar. The general size is less, but with the variability exhibited by third molars, size can vary. When size variation is great, it is more common to find extra-large mandibular third molars and extra-small maxillary third molars. Type 2. This type resembles the permanent first molar with 5 cusps and a similar occlusal pattern and contours. The most common third molar type is the type 1 in conjunction with 2 root branches. Root form. Roots are extremely variable in size, numbers, and curvature. Single fused roots are common, as are two-root specimens. Most often the root length is less than other mandibular molars, regardless of the crown size. These teeth are often congenitally missing or impacted, that is, wedged against an adjacent tooth or bone so as to prevent eruption.